Hello and welcome back to another episode of Age Better, where each week we take a deep dive into all the ways we can feel better, look better, live better, and yep, age better. I'm your host, Barbara Hannah Grufferman. A new study just dropped in JAMA, the top medical journal, and the moment I read it, I knew exactly who I had to call, Dr. Margaret Nachtigall. She's not only a menopause expert and reproductive endocrinologist at NYU Langone Health, but also a frequent guest on Age Better. And she's the medical director of Menopause Cheat Sheet, the newsletter that we created together. Check it out at menopausecheatsheet.com. But let's get back to the study that pretty much blew my mind. Are you ready for this? Hormone therapy might actually help you stay biologically younger. This groundbreaking research suggests that hormone therapy could be a game changer for women in midlife, not only making you feel better, but potentially helping you live longer. Sounds amazing, right? But of course, there's more to the story, and that's why I've got Dr. Margaret here with me today. We're going to take a deep dive into the science, break down the benefits and risks, and most importantly, explore how hormone therapy could help you to age better. So if you've ever wondered whether hormone therapy is the right choice, or maybe you're already on it and want to know more, this episode is definitely for you. Especially if you're in midlife and ready to take charge of your health, stay vibrant, and maybe even slow down the aging process a little bit. So, okay, you know what to do. Grab your earbuds, take me along with you for a heart-healthy walk, and get ready to age better. Stay tuned.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
Your teen requested a ride, but this time not from you. It's through their Uber teen account. You drive your teenager around, a lot, to their friend Jacob's house, their other friend Jake's house, to James's, to Jaden's, to Jalen's, to...
Mom? This is Jake's house, not Jacob's.
Now with an Uber teen account, your teen can request a ride under your supervision. They'll ride with a highly rated driver, and with live trip tracking, you'll follow along the whole ride to their friends' houses that all sound the same. Add your teen to your Uber account today. See app for details.
Bye, Mom.
Good morning, Dr. Margaret. Thank you so much for joining me today on Age Better to talk about a new study that just came out that really intrigued both of us about how hormone therapy might be able to help women live longer. So, of course, because I'm so focused on longevity and healthy aging, I really wanted to get to the bottom of this. So thank you for letting me pull you away from your patients today to talk about this. So the new study does talk about how HT, hormone therapy, can potentially help women to look and feel biologically younger. So tell us about this, and how can it actually help women be younger on a deep cellular level? What's going on?
I'm really happy to be here. And as soon as you asked me, I thought, yes, this is a great topic, because this is a really interesting article. It just came out. It's in JAMA Network, and it's an article that came out of a retrospective study, meaning that it's not the kind of study where one arm of a group of people were put on hormone therapy and one arm wasn't. Instead, this article is from the United Kingdom, and it's the Biobank.
Which is huge and ongoing.
Well, it's 500,000 people. So it's gigantic. And they took 117,000 women, met the criteria for this study. And what they did is they looked, after many, many years, they looked at those people that were on hormone therapy, those hormone that were never on hormone therapy. And then they looked at a really interesting factor, something called phenotypic age. So we know your chronologic age. that's how old you are, how many birthdays we've celebrated, 60, 70, however many years we are. But this measure, which is called phenotypic age, that is a calculated age, which takes into consideration a lot of factors. It takes into consideration biomarkers, chemical biomarkers. It takes into consideration what's happened to the body. Has the individual smoked? Do they have other confounding diseases such as high blood pressure, diabetes, cardiovascular disease, kidney disease? So all of these factors get lumped in, and then they come up with a phenotypic age. The way I think about it is that's not necessarily the way you look, but it's your biologic age, which is what you described. And actually, their big summary at the end, we'll start with the end, is that patients that were on hormone therapy had a lower biologic age compared to the women that were not on hormone therapy. That's a huge finding when you look at 117,000 people. And biologic age is an important factor. And what they say is this measure, this phenotypic age, corresponds to the likelihood of dying. So the younger you are, the longer your life expectancy. So extrapolating, what they found is that people that were on hormone therapy had a longevity, lived longer, about 2.25% more than those people that were not on hormone therapy.
That's an incredible
this is important.
study.
This is important.
Yeah, it really,
Right.
really is. And I also noticed something that the study showed specifically that the most benefits in women who used hormone therapy for 4 to 8 years. Like they seem to have gotten the most out of HT. So what's the significance of that time frame, and how should women think about how long to stay on hormone therapy when they're thinking about this?
Their finding was interesting, and it doesn't necessarily correlate to what other studies have found. They found this inflection point at 7.4 years, which when they averaged it came to their lump of 4 to 8 years. But somehow when you were on for 7.4 years, you saw all this benefit. But then it seemed that after 7.4 years, they didn't see that same benefit in biologic age or phenotypic age. So I'm not exactly sure why that happened. It's hard to know because they also differentiated people that were on hormone therapy continuously and still on compared to those that had used in the past. The other thing about this is because it's not a randomized placebo-controlled study, because it's retrospective, we're looking back, we also don't know what type of estrogen they were on. What was the dose? We don't know the delivery system. We don't know if people were on patches, if they were on pills. We're not really sure. But I do think that it did show that at least being on 4 to 8 years seemed to be a real target. And I think this article also helps us know what we always say, which is we have to individualize. And I think this study that found that hormone therapy kept you younger is something that a lot of us just notice when taking care of patients, is that little things like fewer wrinkles. We know that there are many studies that now have shown, HODIS had that very large study that looked that if you started hormone therapy within 10 years of menopause and you were under the age of 60, that dramatically reduced heart disease. So we've seen that. We know that the earlier you start, the better. There are other studies that have agreed with this and shown less heart disease, less Alzheimer's, less dementia. I think that this helps us put all those other studies into the framework when you're really trying to decide, is hormone therapy right for me? Is this something that I should do? And I also think it's reassuring for those people who are already taking hormone therapy that although it's sometimes a hard decision, at least you're giving it a try and you're seeing if this is a good thing for you.
Right. And there's been a lot of discussion about the risks of hormone therapy for certain people. Because as you always say when you're on the show, Dr. Margaret, that this is not for everyone and it's a very personalized thing. But
that's right.
But especially when it comes to stroke and dementia. You just
Yes.
referenced dementia. So how do we reconcile these risks
Yes.
with the very real potential benefits when it comes to aging and living longer?
Right. I think that that's really, really important. And I think that individual risk is key because one of the risks of hormone therapy, of estrogen therapy, I should say, is that, and let me just take a brief separation. It's hormones or many hormones. Estrogen is really what we're talking about. And the reason that we talk about estrogen with other agents, such as either vasodoxyphene or progesterone, is because we're protecting the lining of the uterus. So in women that don't have a uterus, that have had a hysterectomy, they're only talking about estrogen. And we'll have another episode, which we'll talk about testosterone and what that means. But for now, when we say hormone therapy, we're usually talking about estrogen with either vasodoxyphene or progesterone. So estrogen does have some risks, we know. First of all, if you take it by mouth, it can increase clotting. And so anyone that has a predisposition to develop blood clots would be someone that estrogen by mouth might be too much of a risk for. Someone that has zero risk for clotting, then it may not be an issue for them. So that's why it's really an individual decision. And then if you use transdermal therapy, much less of a risk of an increased clotting, but still a potential risk.
Mm-hmm.
So that's something definitely you want to think about. The other thing is, does estrogen cause breast cancer? There's been a lot of research now. And I think what it comes down to is at least the one that was in the WHI, which is the oral conjugated equine estrogen that was used in the Women's Health Initiative. That really showed a 23% reduction in breast cancer. So it doesn't seem that, even if it doesn't decrease breast cancer, it doesn't seem that estrogen, at least that particular type of estrogen, increases breast cancer. But we did see that the addition of progesterone, at least the one that they used in that study, medroxyprogesterone, slightly increased breast cancer. So if you've had breast cancer, then I don't think that this would be a good option for you.
Mm-hmm.
However, if you're an individual that didn't have breast cancer, doesn't have an increase in blood clotting, I think that it is important to think about this, especially when we look at this very large retrospective study, which just put this in the package that we're already looking at, which is that even if you're not symptomatic, you may want to think about it, but particularly if you're really symptomatic, if you're having terrible hot flushes, your mood are just terrible, you can't sleep, and you're wondering, should I go on estrogen? Should I not go on estrogen? This might help you just feel a little bit better that even if there is some clotting risk to doing this, that there may be some potential benefit as well. Decreasing the chance of diabetes being one of them, lowering your risk of cardiovascular disease, and lowering your biologic age. So I think this is just a helpful tool to be able to help us give people some information.
And certainly great information to discuss with their trusted healthcare provider, right?
Absolutely.
It's something we always recommend people do. With all the concerns from past studies, and again, you referenced the Women's Health Initiative, very, very famous study. How do you advise women about starting or staying on hormone therapy? And I think you kind of addressed it just now with some of the risks, especially once they're over 60.
Right. So the key thing here is that the big HODA study that people refer to and many other studies that looked at the benefits of starting before age 60 and starting within 10 years of your menopause. I like starting as soon as possible, even, less than 5 years is better for me. That never talked about a time to stop. It talked about initiating treatment before age 60. So you can keep taking it when you get older, when you're over 70, as long as you've started when you're younger than 60 and started when you're as close to menopause as possible. So what I like to do is to reevaluate every year, at least every year, sometimes even more, and see, is it still beneficial? Is this still the right thing for this particular individual? What are the advantages? What are the disadvantages? What are they getting out of it? Sometimes when a patient of mine will decide that they just want to try going off, they'll wean off estrogen and notice that symptoms come back. And they really do want to go back on, but maybe they can go back on at a lower dose. And that's something that we do. And sometimes they go off and they don't notice a difference. And so maybe they feel that they're 5 years is enough. But for someone else, it might be 10 years. For someone else, it might be 20 years. So I think that is, again, an individual decision, but something that we reevaluate frequently.
Mm-hmm. I myself have a few friends who are in their late 70s who are still on hormone therapy and feeling really, really great. And so far, so good. Mm-hmm. I'm sure you have many patients.
I have several patients who are over 70, absolutely still on hormone therapy. Mm-hmm. And it's constantly that question. And the big question, I think, is the blood clotting issue, that does increase as you age. But if you have somebody that's been on for a long time and is doing really well, they may decide to just continue.
Exactly,
Mm-hmm.
exactly.
Right.
Which leads me to my next question for you, Dr. Margaret. What do you think? I mean, I think this is something that needs to be studied more. I'm sure you would agree. Like, how long should someone ideally stay on? But what do you think, Dr. Margaret, still needs to be explored as it relates to hormone therapy and aging and healthy aging and longevity and its impact on aging?
Well, we have so much to study, right? Yeah. I think that there's a lot that we are learning about the timing and the initiation of estrogen for postmenopausal patients. I think that the effect on the brain is fascinating.
Fascinating. And we've done a few discussions about that. And, everyone, I'm going to put the links to those episodes in the show notes if you want to kind of link back and listen in if you've missed those.
So in studies in cell culture, it's been shown that estrogen can have an amazing effect on decreasing the tangling, the phosphorylation of tau protein, which decreases the likelihood of Alzheimer's. But if those tracks are already laid down, estrogen can't untangle something that's already been tangled. So it really speaks from a scientific, in the lab study that the sooner you're on estrogen, the better. So I think these are all important factors when we're trying to learn more and more about estrogen. I think what's so difficult and why it's so difficult to study is, first of all, there are so many different types of estrogen. So that's one thing. There's oral, there's transdermal, and many different vehicles and many different doses. But even more importantly is that every person is different. Our cellular makeup is different. Our backgrounds are different. What we've been through our lives. Are we smokers? Are we not smokers? How is our sleeping? What's our immune system like? Is there an underlying autoimmune problem? What's our kidney function? And even just how does our skin respond? Mm-hmm. Everybody is different. No two people are exactly the same. And so even when you try to get a controlled study, it's very difficult to really compare as ideally as we would like to, but we do the best that we can. And that's what's so great about clinical studies, is that you can really try to get a controlled study where you take individuals that are as similar as possible, and then you treat one group and then you don't treat another, and then you look at the effect. So I think more and more we need these clinical randomized controlled studies that can help us figure this out. And hopefully we're doing that. I think the other really exciting avenue is looking for more agents that allow you to take estrogen without progesterone, such as the agent that we have now, which is estrogen combined with basodoxifene. And basodoxifene, similar, I think a lot of you have heard about tamoxifen. It's very similar in that it's what's called a selective estrogen receptor modulator, which means that in some parts of the body, it acts like an estrogen. And in some parts of the body, it acts like an anti-estrogen. Well, it just so happens that it works as an anti-estrogen in the uterus. So it keeps the uterus nice and thin and not proliferated. And so I think that what I would say is more and more we need other agents like this, something that would allow you to take estrogen safely that doesn't have the progesterone with it. But I think that's a whole nother topic, which is more and more research.
More research. Absolutely. We are putting more money behind women's health research. So that's very good news. And I hope that more money will be put towards this. And I think that there'll be a lot more studies coming up that you and I can discuss in future episodes. But I hear your phone ringing off the hook several times during a conversation, which to me means that your patients are really eager to talk to you today, so I'm not going to keep you any longer. However, I always like to end these discussions with you with what are your 3 biggest takeaways from this conversation today, please, Dr. Margaret?
So I think the 3 big takeaways of this is, 1, we really got on this topic to talk about a study that was published in JAMA online first, which was a very large study, 117,000 women. And it was a retrospective study, and it looked at those that had ever taken estrogen, those that were taking estrogen, and those that had never taken estrogen. And what it showed, it looked at basically a biologic age, your phenotypic age, the age that you've seen. And it showed that those people who had taken hormone therapy had a lower biologic or phenotypic age than those people who had never taken estrogen or hormone therapy. We don't know what hormone therapy, exactly formulas they were on.
Right.
So what this study showed was that the people who had taken hormone therapy aged better, that they were younger, that they had a lower biologic age. So that was a key finding. I think my next quick summary is that we, all people who are taking care of women who are postmenopausal, we have to individualize, and we have to take all of their risk factors and their health into consideration, and then help them, and a mutual shared decision making. Education is so key to then answer yes or no. And when you're making that decision, it doesn't have to be a lifelong decision. It doesn't even have to be a 4-year decision.
Right.
It can be just a let's try it. It could be a month. It could be 6 months. So I think key 1 is this study showed lower biologic age. 2 is that always individualize your care. 3 is don't be afraid to get some help. And of course, all the other factors that are important in aging, such as the rest of what you do, your physical activity, your sleeping, your general state of well-being, and all the other good things that we do, like don't smoke. So those are my takeaways.
Those are great takeaways. You summarized very well.
Thank you. And I think luckily, we love talking to each other and with each other. So I think we'll do many more of these conversations where we can really get to the bottom of helping people really figure out if hormone therapy is right for them. But, I think this is just one more piece in the puzzle that is available to us.
Yeah. And you mentioned that we should have an episode focusing on testosterone, which we have not yet done. And I think we should. So everyone, look forward to that. We will get together and talk about that, I think, for our next episode.
Okay. Sounds great.
Okay. Thank you again.
Have a great
Get to
day.
those patients.
Have a great day. I will. Bye-bye.
Bye. Thanks for tuning in, everyone. If you enjoyed this episode of Age Better Podcast, please do a few things. First, share it with all your friends and family. Then, subscribe to Age Better wherever you listen to podcasts, including YouTube, so you never miss a single episode. Finally, if you have ideas for topics you want me to cover in a future episode of Age Better, send an email to agebetterpodcast@gmail.com or reach out to me on social media. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.